Thank you, Mr. Chair, and for the testimony today. I'm going to bring it back to some of the sort of definitions and just nuance in here. Does Michigan law do a good job, in your opinion, right now, of defining what gender identity is? Because we've passed several pieces of legislation recently that refer to it, but do we do an adequate job of defining what that term is?
I would say so. In fact, just like you mentioned, we have passed legislation recently, fairly recently, that actually did define what gender identity was, as we were defining and expanding the Elliott Larson Civil Rights Act to cover the sexual orientation and gender identity. So I would say yes.
Okay, I think I would take issue with whether we actually defined the term. I think we made it clear that there are guardrails, right, that there can't be discriminatory acts based on this. But whether or not we went so far as to say, what do we mean exactly by that term, I would take issue with that. I don't know if anybody else wants to say how exactly we define that, but it's one of these things where one of my concerns is that we tell these health professionals that there's a standard that's going to be placed on them, right, an expectation of how they do care based on certain parameters here, and this is one of those terms. And then I think it kind of puts the ball in their court to know what exactly do we mean by that, right? So I'll just give you a concrete example. I mean, if they have someone who's in counseling who's a very young person and simply says, you know, this is someone who maybe the parents treated as, you know, born a boy, and they say they've decided to transition and they identify as a female. Is that alone, is that the standard where then that health care professional is obligated to say, period, that's it. This young person told us, you know, I am a boy, or said I'm a girl, that's it, end of story.
So every time we get to do therapy with anyone, it's obviously very individual. And part of being a therapist is to be able to bring our expertise to that. And if we have a child who comes to us who says that, that isn't something that automatically, like, yes, there's exploration that happens around that. This is not you come to a therapist and you do this one time and then everyone's done working. I mean, if, you know, I don't know how many of you have done therapy, but it is a longer process where you explore what's going on for you, explore what is happening in your world, what the impacts are. And so I think that to characterize it in those terms can be misleading in terms of what therapy actually is.
Can I add to that?
Yeah.
I would also add, I mean, this is ensuring that Michigan follows the expert recommendations and guidance of the American Psychological Association, the American Psychiatric Association, the American Academy of Pediatrics. These are experts in the field, and it is bringing Michigan in line with a practice that has been widely discredited for more than a decade as something that causes more harm and scientifically is proven not to be something that even works based on what the theory of it is.
Yeah, and may I, just to follow up on that, I mean, I feel like a lot of the conversation about the harms of therapy in the past, correct me if I'm wrong here, but a lot of these studies are specifically about sexual orientation. Isn't that the case? And I don't know that this is the intent of the legislation, but I'm worried that the idea of how mental health professionals specifically deal with individuals who are transitioning has less history behind it, right? In the conversations about, as you said, when a mental health professional, they've got conversations, an ongoing process. When someone comes in and says, you know, I'm a boy or I'm a girl, it doesn't end there, right? And one of my concerns is this legislation actually does close certain doors, that it creates a situation where certain things are off the table in terms of even asking, can a mental health professional ask the follow-up question, are you sure?
That's not
right? I mean,
attempting to convert somebody. So I would say in the process of going through therapy, that is not the therapist as a licensed professional deciding that what their patient has said is wrong and steering them into another direction. And you're going to hear from a number of experts who have worked in this field for a very, very long time who will be testifying with their own experience.
Thank you, Mr. Chair. Thank you for your testimony. I just want to ask about one specific thing you brought up. You mentioned a lot of other countries, some changes that have happened recently. Is it fair to say that there are, the places you mentioned, they were more quick to adopt affirmative care than what the United States has been? And is it fair also to say that that means they've got more evidence, and as they've gone down that road, they're now pumping the brakes and say, let's be more careful, or let's rethink the harm that's being inflicted on people? Is that a fair characterization of what we're seeing around the world?
That is entirely a fair characterization. And it's for that reason that I urge, again, the committee to pause and allow this evidence to be studied more carefully before enacting a ban of this breadth that will cause more harm than the good it will do.